We are talking, if we are serious about realigning incentives in the healthcare system to improve delivery, we are talking about changes that will have substantial implications for many providers, for patients. It's easy to sit here and talk about the positive implications of improving delivery, but there may be negative financial implications. There are complications with respect to how those incentives might overlay on current practice patterns and the variability around the country. The bottom line is, despite tremendous leadership from Mark when he was at CMS and the interest of the Medicare program in serious efforts of demonstration of changing how we do business, the odds that we can reach a national consensus on a different way of paying for health care seem to me extremely small. And therefore, the possibility that state and local efforts can teach us lessons that will enable us to refine our sense of what a better system of incentives would be and to help us answer the question of how to actually bring about those changes. That feels to me like a productive path to go down. But states cannot have this conversation by themselves, nor should they. And therefore, although I can feel enthusiastic about what's going on around the country and much of what Mark described, I also have some concerns, and I think we should be cautious about how far states can go. States really are at the forefront of trying to bring together multiple payers to effect change in how health care is delivered. And so ultimately, as I have written about a range of topics, primarily health insurance coverage, but I think the theory and the thesis applies to this topic as well, states can do a lot, but they are going to achieve much more if they conduct their work in the context of a federal framework. We are a federalist system. There is inevitable tension between states and the federal government, but there is opportunity for states to lead if the federal government is supportive of clearing away some of the barriers that states face. And that's both with respect to the relationship to Medicaid and Medicare and with respect to the role that national private payers and national delivery systems play in a system as they interact with states and state governments.